Hi, it's Dr. Milanes with Luminary MD. At this time, I'm going to treat this patient for toenail fungus. Not a lot of people talk about toenail fungus, but it's really hard to treat. The medications that you use for nail fungus are typically topical, and it's something that you got to use every day. You can also do pills, which is pretty harsh on the liver, or we can do our Aerolase laser, which we do this treatment about once a month. It's going to decrease the nail fungus by heating up the fungus. So it's real quick, easy steps. It's painless. You don't have to do anything after. So here we go. So I noticed in my practice, patients do really well. So I like to treat all the nails because a lot of times the nail fungus can travel from one nail to another. So for the second half, we use the higher power, and then we treat the areas. And then the nail fungus, when patients ask about how it heals, the nail root is what's gonna grow, and then you're gonna get normal, healthy nail that's gonna come out. So it's gonna take time to see a difference. As the nail grows, you're gonna see healthy new nail come in. Perfect, we're all done. And so for this patient, we're gonna do the laser. You come in once a month. If you wanna come in every 3 weeks, you could, but I'm gonna prescribe him a topical medication that we got at the pharmacy, and you just apply that every night. So nail fungus does take time to heal, but with patience and the right equipment, we're gonna get this thing all cleared up. Thank you.